period, including gestation and up to the first couple years of life, varies in definition from country to country, but it is a very important topic in public health. I'd say it's even like a really important trend. The European Parliament passed a resolution, I think last September, saying that every European nation should reimagine this. It can have such a huge impact on childhood development and therefore on the development of that human and everyone they touch over the course of their life. And we know amongst our community and amongst these pioneering practitioners that we can intervene early and then do something very special. I want to represent one of my colleagues, Isabel Fiazat, who couldn't be here today. She had a personal tragedy in her family, but she is on the French Presidential Commission on the first 1,000 days of life, and they are presenting to the Minister of Health next week. So this is part of our effort here on this panel discussion and with this track in our symposium, as well as a forum which may be found on our YouTube page and our AAMS Academy of Applied Myofunctional Sciences Facebook page. We had a forum to call for the reimagining of the first 1,000 days of life. And this will be a white paper of our scientific society that we will be producing with the panelists here and also the panelists in some of the related tracks such as frenulum inspection and revision, which will be track 5 coming up at 1 p.m. California time. So I think it's a real pleasure and honor and privilege to introduce the first panelist, Dr. Hidehiro Abe, who I have introduced in a couple of other fora in the course of this Congress, but he is a pediatric dentist from Tokyo. He saw some presentations, including one that I made at a Japanese Society for Myofunctional Therapy meeting about 7 years ago. And he was inspired, I found out, to really change the course of his practice. He came to the second AAMS Congress in Chicago, and the third one in Rome, and the fourth one in Nashville, Tennessee last year, where we honored him actually with 2 awards, one for his clinical practice, a pediatric engaged nursery school. So he won a Centers of Light Award for interdisciplinary leadership for developing preschools that did myofunctional intervention for small children. And he took dental nurses who were trained in myofunctional therapy and made them teachers at the preschool in order to help kids close their mouth, establish nasal breathing, experimenting. And then he also won an award for his vision and leadership. So thank you very much, Dr. Abe, for being here.
Hello, everyone.
Hello, go ahead. We can hear you.
Okay. Hello, everyone. I think as follows. The ultimate goal of our challenge is not to cure disease, not to prevent certain disease. In other words, people become healthier, more positive, more energetic, and achieve the maximum performance of all their abilities. This is a fundamental step up for humanity. This will greatly develop society and the economy. The biggest problem, however, is that nations and society do not have a firm understanding of the importance and necessity of this. The solution is to share our knowledge, create evidence, and show it to society and the state. In other words, the Congress of AAMS itself will be a guide for human evolution. Thank you very much.
Thank you so much.
I have a medical examination from this morning. So I will leave now to get some sleep. I look forward to seeing you in person again.
Thank you so much. We know it's quite late where you are, Dr. Abe. And I just want people to know before you sign off that if you haven't been able to look at his presentations or know what he does, Dr. Abe has actually brought in myofunctional principles into the preschools, and he's really dovetailed the treatment and the awareness of the child in terms of nasal breathing, functions of chewing, and he's implemented them in preschools. And it's something that is really quite extraordinary. And if we have videos about this in our Congress and in your presentation. So you have been really highlighting not just the need to radically transform the paradigms, but also the economic benefits that you're discussing here, just as you did right now. From your perspective, and I think this is something that all global healthcare systems really could look at this, the prevention really saves so much of our economic toll in health systems. The preventative measures that are undertaken in this specific period of the first 1,000 days of life. That's why the focus on this period is so critically important, because if you don't intervene during this time, then these interventions are much more intensive and have a much higher cost to healthcare systems around the world. So I just want to say thank you for your contribution. What you do, you're walking the walk. And again, if you can visit Dr. Abe's presentations inside our AAMS Congress, you'll find a lot of insight into how he has implemented these principles in his own community. Thank you again. Thank you.
Thank you.
I want to pass the baton here over to Solveig Holmsen, who is with us from Norway. Solveig, would you like to just introduce yourself and how you became interested in myofunctional principles and what you've undertaken to implement awareness and change, specifically in your own community, country, and looking at frenulum inspection and the developing child? Your presentation has been really well received, and it's really an amalgamation of research and implementation around how we can treat these children differently in these first 1,000 days. So Solveig.
Thank you, Samantha, and thank you so much for inviting me to the Congress, and thank you to the AAMS for a fantastic Congress. I am an MD from Norway, and I got an MPH from just after I got my medical degree. And then I was going to be a surgeon, but I ended up just working in the emergency room, where I saw many mothers with lactational mastitis. So I was thinking I should do something to prevent that. And I started working with breastfeeding in our National Advisory Unit for Breastfeeding. And after being, we have always known that tongue ties may be a problem for breastfeeding. but we didn't know that it was this big problem. And then 4 years ago, we started to look into that. And I learned how to diagnose and treat tongue ties. And after I went back to the ER and looked in the mouths of the infants, of the women with lactational mastitis, I found many more tongue ties and started treating them. And of course, we could see that the experience was that the treatment helped, and the breastfeeding problems resolved, and they were doing fine, and they could continue breastfeeding for months and years. And in Norway, breastfeeding is really, Norwegian mothers are really motivated for breastfeeding. So they are going through a lot of pain and infections and trouble to continue breastfeeding, but sometimes they just have to stop because of all these problems. So it feels really satisfying to be able to help them. But the medical community in my country haven't understood this so far, but we are making progress, and we have written a knowledge-based guidance document that we will soon be publishing. And I'm also doing research on tongue ties. I'm on a PhD project. So we have progress, and it's getting more into practice, and the mothers also are demanding the help, and there's this support group on Facebook with 8,000 members, and that's a lot for Norway. We have 5 million inhabitants, so things are happening. And but after, I started to look into tongue ties, and I read more, and then I found that it may even affect oral development and the airway, and that was really new to me. Never learned anything about that in medical school. So I think that is most medical professionals and dental professionals, they are not aware of that in my country and in many other countries, I think. So I think that actually awareness of this problem, that the oral myofunctional disease problem, and of course tongue tie is a part of that, that the awareness is very low, that is actually the problem. And we have to make the public aware of this problem. And also we have to make the medical society and the medical practitioners and the dental practitioners see this problem. So.
Well, I just commend, you've gone out into the world and all over and learned from many different people. And I think part of this exchange of information that we're hoping to do with the AAMS is to elevate the profile of all of these issues, conditions, so that we are educating each other, and it is research-based and it is rooted in science, so that the public is another avenue, and going directly to the public. And as you are working with mothers, Solveig, and how that impacts their own feeding experience with their babies. My question is, in terms of the challenge specifically, what would you say is part of this challenge and opportunity?
The challenge is to make awareness of this problem, of how myofunctional disorders may affect oral development and airway and breathing and sleep, of course. And that's really fascinating to see this how this hangs together. And also that the parents should know that when the breastfeeding is not working, we have to find the reason and do something with that. And in some of those cases, or in many of those cases, it's a tongue tie, and it's pretty easy to treat early in life. But I have also seen that this multidisciplinary collaboration is really important in treating tongue ties. And I didn't know that in the start. It was just cut and run in the start. But after getting a lot of knowledge from the literature, and also from conferences, and from the AAMS course and conferences, I think now we see that it's not that easy. We need to work multidisciplinary.
Thank you. And I want to also include Michelle Emmanuel, who is a clinician. She's an occupational therapist. She is, she works in the realm of the pre-crawling infant. That's her specialty, and beyond, because as she will tell you, the system of the child, the baby, is, it wraps around the entire family and beyond. So Michelle, I'd love to introduce you, bring you into this because of your experience, and you work with families very closely preparing for tongue tie release, but you also are looking at the oral neural motor development of the child. So if you want to kind of introduce what you do.
Okay, yes, thank you. And I am a pediatric occupational therapist. For 17 and a half years, though, I worked at a large children's hospital and got a lot of experience. Half of that time was in the NICU, working with very ill babies and noticing, working with breathing dysfunction and movement and neurodevelopmental problems. And then the other period working in outpatient and seeing oral motor feeding therapy problems. And at the same time, getting into the tongue tie world. This was about 15 years ago, and I started my private practice on the side. And I learned a lot along the way about tongue tie, but it's also changed throughout this time. And it's become more, we're noticing more the whole body effects and symptomatology of tongue tie and oral dysfunction. But because we have to remember that what these are they're congenital anomalies that have limited the embryologic development of the structures of our oral development. So it's also how we practice in the gestational playground throughout fetal development. And so when babies are born, they're quite familiar with the patterns that they have for sucking and swallowing. And coordinating breathing on top of that is a very big challenge, especially if you have some sort of restriction or oral dysfunction. So along the way, I learned about manual therapy and how to do body work type things, and also more about, my big thing is looking at cranial nerve function and integration and optimization, but how the brain is responding through the movement bodies and the unique properties of the pre-crawling baby. And somebody said earlier, it's so important to intervene at the earliest time because we can have the most impact and change before, like we were saying, the neural pathways are even laid down for more movement. So it seems like we also need to remember not just fetal development, but the first 12 weeks after birth is called the 4th trimester. We're very much still gestating. And I'm convinced now, because my practice is, I do full-time seeing babies. About half of my caseload is home birth. So I get to experience what it's like for non-interventional births. And they are showing up with just as many problems with tongue tie as medicalized births. Okay, there's other challenges in the two, but I'm seeing babies over and over have, certain patterns of recognition and the dysfunction. And so anyway, I get excited about talking about that. But it's also not just about the tongue tie, because if a baby has restricted tethered oral tissues, it is going to be found somewhere in the whole body symptomatology, in the neural development, in the cranial nerve integration, in the breathing patterns. And so we're going to look at all the domains of development, which are physical, social, emotional, interactional, sensory processing, especially oral sensory processing, which is impactful because of babies. This is the oral sensorium. This is the most sensory rich and supposed to be the most sophisticated area of a baby's body. And the babies develop head to toe. And so when there is a problem with the tongue, the jaw, the lips, the face, the neck, the shoulders, then that detracts and the whole body shows that. So we've got compensations from things not being able to happen. And then we also, though, need to not just help us pull away from compensatory and more optimized, but we have to teach new novel movement patterns. And so that takes a lot of intention and multidisciplinary collaboration and a focus on breastfeeding and optimal development and connection. And it's sort of a sensory thing as well. And we were talking, someone mentioned ADHD earlier and autism, which are very much social, emotional, interactional, and sensory processing differences. And so that can really start with the tongue. And when a baby has to go through the tongue tie release process, it can be intense for the baby and the family. And we want to make sure that we have, because with support and resourcing, it can be smooth as possible. And I'm very much about watching babies throughout the continuum and not just thinking that when we're treating them, even as babies, that, well, we're done. We got this earliest intervention and we did what we did, but to keep our eye on these babies and help them through the advancements and regressions of normal development to help meet the needs that are going to come along, because these old vulnerabilities will come up throughout growth and development, and to keep on track almost, people at each stage where there's an expertise and a support. And of course, I would love collaboration with all the pediatricians. And for me, it's a no-brainer, but I love how Mark said earlier that it's up to us to create the science and sort of the field in order for it to be like given, right? We can't expect the pediatricians to be the one to prove that it works or that it makes sense. And so I really like that, of us like collaborating multidisciplinary and creating the science, so that it has to be noticed.
A lot of the challenge when it comes to the pediatric world is, the hierarchy of needs. And, these acute conditions are going to get the most attention first. And so much of this oral dysfunction, as you're describing so well, is this slow compensatory trajectory of compensation. So what I mean by that is these chronic conditions really go under the radar so much, and they just don't get the attention unless they're severe enough to bring in the intervention. So what you're saying is that we really need to look at the whole spectral development, and to really see, and with our eyes, to observe that child, to see where that interaction is on track, where their motor processing, their sensory emotional engagement. I just love how holistic you are in the whole child and the arc of its development, which really goes back to the parents and the community looking in, right?
Yeah.
So I wanted to see if, because we have Eyal Bozer here, he's with us from Tel Aviv. Thank you, Michelle. We're going to come back to you, I'm sure. Do you want to say something else?
Well, there was one thing I was going to say, was that we need, eyes to see and ears to hear. And so to work on easy tools for identification and assessment and treatment and remediation of these as early as possible, anytime we see oral dysfunction. So the identification, and be able to see it and to say, hey, we can help. And this is what we do.
And I know you've done that. You've created easy assessment tools to identify what it is specifically that you're looking at, so people have a much easier time to access what that is.
Yeah, because babies have a very rich social nervous system, and this happens to be what's impacted when there's tongue dysfunction. So it's an easy interface.
Yeah,
To
absolutely.
address that.
Thank you.
Thank you so much.
Thank you.
Thank you for reimagining this. It's so amazing, and I am very proud to be a small part of the whole.
Well, you're a big part of the big whole, because it is a collective. And, you know, the idea is that we get voices out there, that people hear this, so that the language also changes, because that's the, you know, reinforcing these concepts. It might feel repetitive to us, but it's the first time for many people who just haven't looked at it in these ways. Whether you're a clinician, a provider, a parent, a family member, you know, so we need to reimagine the language that we're describing and bring it into the arena. Eyal, I'm very happy you're here with us. Thank you for being here. I wanted to introduce you.
Thank you.
Would you like to describe what you do and where you are and your perception of how critical these first 1,000 days of life are from your keyhole perspective?
Sure. I started as a dentist that thinks there's no connection between tongue tie and breastfeeding or any other issues. Even though as a dentist, I learned about tongue tie, that there is a fold under the tongue and that's it. And sometimes you should get rid of it. Other than that, I started the research on tongue tie the year 2000. And following that, we got the understanding that it interferes with breastfeeding. Unbelievable, but just in the year 2000, I got this understanding. And then with time, we get to see more and more the implications of a subfunctional or dysfunctional oral environment, which starts with breastfeeding, but then there is an importance about breathing, maxillofacial development, and all the implications to the other fields of life. So today, my understanding is that it has to be a team approach, and we have to educate. And the education should start first with research, and then get into the dental and medical schools and other professions, understanding what is the implication of a subfunctional oral system. And not only the oral, actually, if the child is born with torticollis, he will not function properly, and the implications are lifelong. So today I'm in Ichilov, the Tel Aviv Medical Center, where we started a breastfeeding and research center. It takes time. It takes a lot of time to educate the system, but we are doing it slowly, hopefully for surely as well.
Well, you definitely have been doing this for many years, along with Michelle, looking at the baby and, you know, bringing in new information to places that don't always have it, and going out to get it and bringing it in. So, you know, thank you for what you do and working with moms so empathically and understanding their experience, because that's a big part of it too. And education, absolutely. Curriculum and changes. We have Deborah Catoni here, who I wanted to introduce. She is a leader in this field of myofunctional sciences from Brazil. She's given a great presentation for the AAMS. We really appreciate your contribution, Deborah. And we're talking about the challenge that we see in the first 1,000 days of life specifically. From your perspective, what issue is at hand, and how do you approach it in your practice? Hold on, we got to have you unmute. There you go. There you go.
Are you
Yep.
me? Sorry. Hi, everyone. Good afternoon. It's a great pleasure to be here with you, with many respected professionals around the world. And it's a great honor to be here. And I'd like to congrats you all the staff, or the organization committee of this wonderful Congress. And to this panel, I bring the theme that it's a problem to hear in Brazil, that the prevention of the myofunction dysfunctions and its relation with the craniofacial development. So here in Brazil, we have a law, Teste da Linguinha, and it's very important to prevent many dysfunction disorders, myofunctional disorders. And we know that the ankylosing can affect the craniofacial development. And so it's here in Brazil, all babies do this, is submitted in this evaluation. And we have also to work with these children and evaluation and prevent the oral mouth breathing and problems with the chewing and swallowing. So here in practice, our challenge is to have and to guarantee this work as early as possible to prevent many orofacial dysfunction, and especially oral mouth breathing, as I talk a bit about my work in my speech during the Congress. And I think it's very important to be attention with this function. And here in Brazil, we are working hard to work with these children as early as possible to prevent also speech problems and tongue and lips posture, wrong tongue and lips posture. And we are doing here in private clinics and also in public clinics also. So I think that's a great challenge for us to prevent. And the first step we do is the Teste da Linguinha, that all babies can receive this early evaluation 2 days after birth. And then we can, with this, we can prevent many dysfunctions and also to prevent the early, like moms, I don't know exactly the word, aleitamento precoce, aleitamento.
Breastfeeding.
Yes, breastfeeding. And so we can guarantee that these children can receive the breastfeeding appropriately after this evaluation of the Teste da Linguinha. I think it's...
And so just so that people know what you're describing, it's the law that has been passed in Brazil to inspect the lingual frenulum at birth. This was part of the initiative that was put into place with Roberta Martinelli and her protocols, but I know many others assisted and passed policy. And Mark, did you want to just say a few words about that?
Yeah, it's something important to note here. I've had the privilege of being engaged with the group that pushed for the frenulum inspection law for the last 9 years or so. And the real vision behind it and the brilliance of it is not only for breastfeeding, but to avoid the orofacial myofunctional disorders later in life that we see, what we've established as like a correlation to sleep apnea, or, like Dr. Kevin Boyd talks about, malocclusion being a craniofacial morphological indicator of much more severe issues later in life. But something I want to just circle back. I've also had the privilege of the last 10 years or so occasionally visiting Dr. Deborah Catoni in her practice in Sao Paulo and seeing her speak and lecture many times. And what's extraordinary is that she has developed techniques that what we would call infant myofunctional therapy or pediatric myofunctional therapy, where she does this kind of intervention for children, who are not, following exercise instructions or following lists or sheets or things like that. And it's extraordinary, for us to be able to reimagine the possibility of this baby, infant, toddler, pediatric myofunctional therapy. And it's part of what we're calling for in this reimagination of the first 1,000 days of life. So I was wondering, Dr. Catoni, if you could maybe comment on that kind of early intervention and techniques that you do that aren't necessarily part of the standard training curricula.
Okay, thank you, Mark, for helping me with the language. Thank you, thank you. In my private clinic, we receive children too early, and we have our work with the perception and conscientiation. The children can with a contest, a ludic, with toys and with a contest properly to
Games
children.
and toys, right?
Games, yes, exactly, and we can help these children to establish the or the nasal function,
Nasal
and
breathing.
nasal breathing, and we also work more with the functions than the muscular training, and also we can train with the like a snack, having the lunch with us, and training in a ludic contest with the participation of the parents, so we can have also the orofacial functions trainment at home. Also, we also use books. Once you gave me a book, very nice, with the theme is about the tongue posture. Do you remember?
Tucker the tongue finds his spot.
Yes,
Actually,
yes.
Samantha wrote that.
Yes, so we have specific materials to work with these children, and we with also with the families, and we can work with the chewing, the swallowing, the nasal breathing with toys and these stuffs, and the perception of the children to do the right pattern.
Yeah.
I think this is such an important topic, and maybe as we explore some other additions to the program over the month of September, we should have a panel discussion specifically around this, because I know Michelle Emanuel and our next presenter or panelist, Katrina Rogers, have their own techniques, and this is something that I know Samantha's been exploring as well. So Samantha,
Well, I
you
do want to introduce Katrina. We have a little bit of time, but Katrina, you specialize in dysphagia, and your work with the infant population has been directly impacted by your work in myofunctional principles. Do you want to just say what you perceive in this area?
Yes, yes. I've been a speech language pathologist for many years, working across mainly in pediatrics, but looking at children who have dysfunction. So thinking about children with speech language issues, ADHD, complex neurodisability. And I think that as well as dysphagia, which is my specialism, but I think that what really has drawn me into this track particularly is there are so many things going on that should be addressed early on. And in the UK, which is where I'm based, we have a first 1,000 days policy, which has been around for a few years, but actually in practice, I would say that doesn't come together. And I think that possibly that is linked to multidisciplinary working, medical healthcare systems working in a reactive way and not in a preventative way, so that what we really need to do, and you've mentioned about cost saving benefit to healthcare services, but what we need to really think about is prevention. But actually prevention can be challenging as well, because there's so many emotions. And sometimes, you know, in my clinical practice, when I talk about, you know, a child who has an eating or chewing or swallow difficulty, and then you start thinking about other health issues in a young child, how sleep, how those things that's kind of off the radar, and people don't really know how all of this integrates and connects together. So
Yeah.
Okay.
No, I just want to say thank you, because we are on a schedule. We're going to be going over every track today with panel discussions based on that track. And this is track 2, the first 1,000 days of life. We have touched on many aspects, but of course there's more. So what we want to welcome you to is this next part of our Congress is going to take some different forms. And one of that is to be looking at a forum on infant and pediatric myofunctional therapy. And this will be coming in to September's schedule. So if you're a part of the AAMS Congress, please know that September has a whole other layer of events and foci. So that is going to wrap up what we have here today for the track. Thank you, everyone. The track 2, first 1,000 days of life. We've heard from different speakers, different disciplines, and thank you again. And we're going to start at the hour. So on the hour, we're going into track 3. So if you're staying tuned, just hold tight and then tune in live on the hour. Thank you again.
Thank you.